Absolutely, Tessa. We've had to wait several days for the formal announcement of this three-tier system, but today we finally did get that formal announcement. The reason it's taken a while is because the government's been negotiating with local leaders as to what level exactly various different parts of the country will go into. Now, some local leaders have been agreeing with the government, but so far some local leaders have not agreed. Nevertheless, the government has gone ahead because they believe we've reached the point with the virus today where we're at a tipping point. For the government, there's no longer any doubt we are in a new phase. The infection is spreading and new measures are needed to control it. Simply carrying on is not an option. So today, the Prime Minister announced that the whole of England will now be divided into 3 COVID alert levels.
Just as we simplified our national rules with the rule of 6, we will now simplify and standardise our local rules by introducing a 3-tiered system of local COVID alert levels in England are set at medium, high and very high.
He confirmed Liverpool would be on the very high level, but he also made it clear there were still negotiations going on with local leaders to determine exactly what level would apply across much of the north of England.
Engagement with other leaders in the northwest, the northeast and Yorkshire and Humber is continuing. I know how difficult this is. They, like us, like everyone in this House, are grappling with very real dilemmas. But we cannot let the NHS fall over when lives are at stake.
The Labour leader said he believed action was needed and that he'd consider the measures put forward by the Prime Minister, but
we've tried to give the Prime Minister the benefit of the doubt, but it increasingly feels like the Prime Minister is several steps behind the curve and running to catch up with a virus that he has lost control of long ago.
Earlier it was confirmed that 3 Nightingale emergency hospitals in Sunderland, Manchester and Harrogate have now been put on standby as the pressures on the NHS grow.
In fact, we now have more patients in hospital with COVID-19 than we did before the government announced restrictions of March the 23rd in the spring. As the Secretary of State for Health has said, if we do not take measures to control the spread of the virus, the death toll will be too great to bear.
There's grim acceptance from most scientists and medics that measures need to be stepped up, but also that any breathing space must be used properly.
It's very important that that period is used to develop an effective test, trace and isolate and support system.
What's announced today is not as bad as the first national lockdown back in March, but the message is if we want to avoid this again, we must follow the rules now. Andy Bell, 5 News.